The targets set out by the joint United Nations Programme on HIV/AIDS in 2016 outline that 90% of all people living with HIV should know their status. 90% of all people diagnosed with HIV should receive a sustained antiretroviral therapy, and 90% of all people receiving antiretroviral therapy should have viral suppression. According to the Unaids, countries signed on to the strategy were expected to achieve these targets by 2020. However, despite several efforts and new approaches by the Ministry of Health through the National AIDS Program Secretariat over the years, Guyana was only able to surpass the first target in 2020. During his daily COVID-19 update on Wednesday, Health Minister Dr. Frank Anthony announced that 95% of over 8,000 persons living with HIV know their status.
The second 90, however, having people on treatment, we're still at 71%. So there's still a lot more work to be done there to get more people on treatment. And for those who are on treatment, who are now virally suppressed. And when you're virally suppressed, it means you can't transmit the virus to anyone else. For that third 90, we in Guyana, we are at 69%.
He noted that at a high-level UN meeting which convened on Wednesday, discussions were held on increasing all three of the targets from 90% to 95%. This would require countries that are signatories to implement effective strategies to achieve or exceed the goals. Guyana will be exploring additional ways of improving its HIV response.
And we're looking at getting persons who are HIV positive to be more involved in decision making. We are looking at the key populations to not only be part of decision making, but to be able to offer things like testing as a service, to be able to provide services such as treatment and care.
In a recent exclusive interview with Nightly News, manager of the National AIDS Program Secretariat NAPS, Dr. Tyreek Jagnaran, had said that the lack of access to specialized testing for viral load and periodic shortages of antiretroviral drugs for persons living with HIV were among some of the factors that contributed to the non-attainment of the targets.
Having specialized testing for viral load, drug resistance, continued testing in terms of we would have had cases of the equipment in order to do this testing. We don't have sufficient amount, but now that has been addressed. The drug shortages that would have been there would have affected people being achieving those viral suppression. Additionally to that, we would have had access to persons who are HIV positive not accessing the drugs. So it's a complex, multi-faceted issue.
Meanwhile, on the subject of vaccination, Minister Anthony informed that more than 214,251 persons have been partially immunized, while 79,802 have accessed both doses of the vaccines as of Tuesday. Temika Rodney reporting for the HGP Nightly News.